One.
Good morning, July 7th, 2026. I'm Dr. Deukmedjian, CEO and founder of Deuk Spine Institute. You are watching laser spine surgery at its finest. Deuk Spine Institute has developed the best, most advanced laser spine surgery in the world. We use the least invasive technique. There is no bone cutting, no bone removed, no ligament removed, no muscle damage. The only thing we do is a small incision in the skin that's 7 millimeters, quarter inch. And then under the skin, we use a dilator to spread the tissues gently and atraumatically. We then get into the herniation directly, where we are going to repair the herniation by getting rid of the nucleus pulposus that's stuck out there. We're going to clean the tear where the herniation came out. Finally, we're going to allow the disc to heal naturally. All right, today our patient is having surgery at L4-5. This is probably the most common disc to have problems. Let's show the audience, while we're getting into this disc from the left side, the 30 different causes of back pain. Shot? I'm Dr. R. Deukmedjian with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, touches the vertebral bodies. With trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with x-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deukmedjian. Thanks for joining us. Welcome back. You can see the 30 different causes of back pain. The most common by far is disc injuries. Let's take a look at the x-ray real quick, just so you all can see. So we have the L4-5 disc full of dye. We injected dark dye, and that's why you're seeing it on the lateral view. We now have the dilator. It's come through the foramen. Show the foramen. It came through a natural hole on the side of your spine, and it's sitting inside the tear in the back of the disc. Show us the front of the disc, front and back. So that's the L4-5 disc herniation in the back of the disc, and the dilator is inside that tear. Now we're advancing our tube. This is the endoscopic tube. We're going to do the whole surgery through this tube. Show them the tube, Jordan. You guys see that tube? It's literally a 1/4 inch side to side, 1/4 inch, 7 millimeters, and the whole surgery will be done through this tiny tube, which is why our patients don't have any damage to their body internally. They have no need for pain medication after surgery, so we don't give them any, and they go home an hour after surgery. So you're watching the most advanced spine surgery to treat a painful back. We also do this in the cervical spine for cervical disc herniation, and we do it in the thoracic spine for thoracic disc. Okay, here's the herniation. You can see it right there. I'm going to sharpen the image just a little bit by adjusting the focus of the camera. Perfect. You could see some pinkish tissue. That's all inflammatory tissue. That's where the inflammation is happening in the back of the disc. I've been teaching my fellow surgeons, spine surgeons, for 20 years about inflammation happening in the disc as a source of back pain, but they don't listen. They just want to keep doing surgeries that don't work, like fusion of the spine, artificial discs, spinal cord stimulators, pumps, shots, pills, therapy. None of those things fix this problem. The only way to fix a painful disc in your back is with the laser surgery here at Deuk Spine. It's called the Deuk Laser Disc Repair. Let's show the audience how these disc injuries, the #1 cause of chronic back pain, how they happen, and more importantly, how they cause pain.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349.
You can see from our animation video that the disc normally is painless. We all have discs in our back. They're cushions between the bones. They're flexible, they're compressible. They're made up of two things. One, the ligament that holds the bones together, called the annulus fibrosus. It's a ring-shaped ligament. It's very strong, made up of 20 layers of collagen and elastin interwoven. And you have inside of that a jelly, a compressible jelly called the nucleus pulposus. So when we get a traumatic injury to our back, we end up tearing the ligament and crushing the nucleus. The tear in the ligament, if it happens in the back of the disc, will lead to a herniation of the fragmented nucleus. Fragments of nucleus that herniate through the tear set up an inflammatory response by the body. And the body attacks those herniations thinking that they're foreign, they're not part of you, that they're invaders trying to get into the body because it's never seen them before. So it attacks nonstop, day and night, creating all this pink inflammatory tissue. And that's how people get back pain from a disc injury, okay? That's what this patient has. We just confirmed that on his discogram. We did a discogram, he had 10 out of 10 pain at L4-5. Now we're fixing that problem. Deuk Spine Institute is the only place in the world you can go to get this surgery because we pioneered it here. We've peer-reviewed, published it. It's FDA approved. It's only available here, and this is where you should go when you have back pain. Any questions?
No questions.
All right. The next patient we're operating on, he's actually from Lebanon, originally, Beirut area, and he has piriformis syndrome, sacroiliac joint pain. We're going to be operating on him next. Painful discs here at Deuk Spine Institute.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. We are just finishing up the Deuk laser disc repair here on this patient. There's a little bit of haziness to the view for you because, well, there's so much inflammation coming from this disc that there's a little bit of blood in the water, and that's what makes it hazy. If I were to maybe stop the flow, you might actually see a little bit more. You guys see all that? That's all scar tissue, an wall of scar tissue. That's not supposed to be there. That's because his body, look at the blood right there. You guys see it? Kind of just coming there?
Yeah, we
out.
do.
Now, normally the disc itself has very little blood supply. That's why there's normally no bleeding in the disc. However, when you have an injury like this patient, that injury can go from the outside of the disc with a tear, a herniation, and extend interiorly into the disc so that the whole wall of this can become very painful. Any questions? I got 30 seconds left.
No questions.
Oh, you guys know everything. So we've already shown them how the 30 causes of back pain. We've already shown them how a disc injury causes chronic back pain and how we use the endoscope and laser to repair the disc with the Deuk laser disc repair?
Yes.
So we've shown all the appropriate videos.
Yes, we have.
Excellent. All right. And no questions?
No, we just have a comment from Knight of Justice on YouTube.
Knight of Justice, I love your name. It's a really cool name.
Yeah,
Go ahead.
He said it looks like cotton candy.
Yeah, it does. It does look like cotton candy. So the laser is 1 millimeter. Remember, 1 mm, 1 millimeter. So it's very small. But it looks big because the endoscope is a magnifying lens system. It makes it look bigger. But you can see, look at this tear. We're just about done. And the tear itself has shrunk down to about maybe 3 millimeters wide. Okay? That's because we took the herniation out of there that was holding the tear open. I've removed the herniation. And now look at this tear. There's the millimeter fiber. The tear is only about 3 millimeters wide. We're done. That will heal itself now. And his pain will be gone when he wakes up from surgery. Literally gone. Because we just took away the source of his back pain with our laser spine surgery. Thanks for joining us. Our next patient, as I said, comes from Lebanon. And he's got back pain. And his back pain is not coming from the disc. Actually, it was coming from the disc. We already fixed his disc. He's back because he has pain coming from his SI joint and piriformis muscle below his spine. And that really wasn't a big problem for him. It wasn't as painful as his disc injuries. But since we fixed his disc and he no longer has disc pain, now his SI and piriformis are bothering him. So we got rid of one source of pain, but he had these other sources that we're going to fix next. So please join us for bilateral SI joint DPR, bilateral piriformis release. Thanks for joining us. I'm here with one of my post-op patients. We get a lot of requests for Dr. Deuk. Can you show us a patient that had the surgery several weeks ago? Well, here's one. She had the Deuk laser disc repair done at L3-4, L4-5. You were having back and leg symptoms before surgery. How are you doing today?
I have no pain today. I have no pain today. I suffered for such a long time. The leg pain was there for a good close to 3 years. I got to where I could hardly do anything. I'm normally an Energizer bunny. I'm always busy doing something all day long. It terribly curtailed my life. I couldn't hardly do anything without being in pain. And for a long time, I had to push through some just to do normal things, just to get me ready for the day. Now, it's gone.
Amen.
It's gone.
Now you had your surgery done here at Deuk Spine Institute in Florida in between two massive hurricanes, right?
Yes.
We had Milton recently, and before that we had Helene. And you had your surgeries smack in the middle of those two, between those two hurricanes.
Yes.
What brought you to Deuk Spine Institute?
Well, my husband always trying to find something to help me. He did his research, and online we found you. So we came to see what you offered and what could be done. The other doctors wanted to fuse my back and L5 all the way to my tailbone, and I didn't want that. I was afraid of that. I had done decompression surgery at L3-4-4-5. Within a few weeks after having that done, I was right back in the same pain.
We tell people about laminectomy. You had a laminectomy, it
Yes.
didn't work. I tell people avoid laminectomies. They're removing bones and ligaments out of the spine. It's very invasive, bloody, and damaging. But the laser surgery you had with us, we went in with a small, tiny Band-Aid incision.
Yes.
Outpatient. There was no bleeding.
And no pain from the surgery.
No pain from the surgery.
Wow.
Right?
I couldn't believe it. I'm like, you gave me a prescription for muscle relaxants, and I'm like, no pain surgery? I called to make sure. Are you sure? Because I don't have a drawer full of pain pills because I don't believe in them, but I know I need them for surgery. I needed them when I had my decompression surgery. I needed them when I had emergency cervical surgery, and I had no pain, no surgical pain.
Yes, our procedure is so
Wow.
gentle that there's no surgical pain and you don't need to take painkillers.
No.
Amazing. Well, thank you for sharing your story with us. And you've been through so much, and you're in my prayers. I hope you do very well. Enjoy life.
Thank you. I so appreciate the prayers.
You're welcome.